Good morning, class. Today, we will be diving into the fascinating world of the Mental Status Examination, MSE. The MSE is a valuable clinical tool that helps us evaluate a patient's cognitive, emotional, and behavioral functioning. It provides valuable insights into their mental state and aids in the diagnosis of mental health disorders. In this script, we will explore the various components of the MSE and discuss their purpose in assessing mental distress. In the video, we will discuss the Mental Status Examination, MSE, a comprehensive assessment tool used by healthcare professionals to evaluate mental state. We will explore its purpose, components, and how it provides valuable insights into an individual's mental functioning. The physical appearance and behavior of a patient can reveal valuable information about their mental state. Observing their hygiene, grooming, dress, posture, and demeanor can indicate potential mental distress. Behavioral observations, such as motor activity and restlessness, help identify signs of anxiety or other disturbances, providing insight into emotional well-being. Assessing affect and mood is vital for identifying mental distress. Affect refers to emotional expression during the examination, while mood refers to prolonged emotional state. Evaluating quality and appropriateness of affect helps diagnose disorders, while assessing mood aids in developing treatment plans. In the Mental Status Examination video, we discuss the evaluation of thought content and perception. This includes assessing for delusions, which are false beliefs, and identifying hallucinations, which are sensory experiences without external stimuli. By carefully assessing these aspects, clinicians can differentiate between different psychiatric conditions. The evaluation of speech and language provides valuable information about an individual's cognitive functioning and communication abilities. Fluency refers to the smoothness and rhythm of speech, while coherence examines the logical organization and structure of the patient's thoughts. Content evaluation involves assessing the appropriateness and relevance of the patient's speech. It helps identify abnormalities such as poverty of speech, tangentiality, or flight of ideas. Thorough examination of speech and language aids in diagnosing conditions like aphasia, dysarthria, or thought disorders. Assessing thought processes focuses on understanding the patient's thinking patterns, logic, and coherence. Clinicians evaluate coherence by exploring if the patient's thoughts progress smoothly and logically. They also observe if the individual can express ideas in a structured and organized manner. Identifying thought disorders, such as loosening of associations, circumstantiality, or tangentiality, is crucial in diagnosing psychiatric conditions like schizophrenia or bipolar disorder. By evaluating thought processes, clinicians can gain valuable insights into how the patient organizes and communicates their thoughts. In the section on evaluating orientation and memory in the Mental Status Examination, MSE, video, we focus on assessing an individual's awareness of time, place, and personal identity. We ask about the current date, location, and personal details to evaluate their orientation. Memory evaluation includes immediate and remote memory tests, which help diagnose cognitive impairment or memory disorders. Attention and concentration assessment allows clinicians to gauge an individual's ability to sustain focus and concentrate on specific tasks. They evaluate the patient's attention span, distractibility, and ability to shift attention. Clinicians may use exercises to assess sustained attention, such as asking the patient to count backward from 100 in multiples of 7 or to list words starting with a specific letter. Assessing attention and concentration provides valuable insights into conditions like attention deficit hyperactivity disorder, ADHD, or delirium. Abstract thinking assessment explores an individual's ability to understand and interpret abstract concepts. It involves tasks that require the patient to identify similarities, differences, or associations between various objects, ideas, or proverbs. Impairments in abstract thinking can be indicative of conditions like cognitive decline, dementia, or intellectual disabilities. Accurate assessment helps clinicians detect deficits and tailor appropriate interventions for the patient's cognitive and intellectual needs. Evaluating judgment and insight allows clinicians to assess a patient's decision-making abilities and self-awareness. Judgment involves analyzing the individual's ability to make appropriate decisions based on presented scenarios or situations. Insight refers to the patient's understanding of their own mental state and the potential consequences of their actions. Impairments in judgment and insight can be found in conditions like personality disorders, substance abuse, or severe mental illnesses. Thorough assessment helps in determining the patient's capacity for independent decision-making and their overall insightfulness. Cognitive functioning assessment focuses on a comprehensive evaluation of attention, memory, and language skills. Clinicians employ various tests and tasks to evaluate the patient's cognitive abilities, including attention span, memory recall, and language comprehension. Accurate assessment aids in diagnosing cognitive disorders such as Alzheimer's disease, vascular dementia, or aphasia, and allows for appropriate management and interventions to support the patient's cognitive needs. Understanding the influence of cultural factors on the MSE is vital for accurate interpretation and diagnosis. Culture shapes an individual's perceptions of mental health, expressions of distress, and help-seeking behavior. It also affects their beliefs about mental disorders, symptoms, and treatment preferences. Recognition and appreciation of cultural diversity enhance the accuracy of the MSE assessment, prevent misinterpretation, and enable the provision of culturally competent care. By considering cultural factors, clinicians can provide a more holistic and inclusive approach to mental health evaluation. In conclusion, the mental status examination is a vital tool for assessing an individual's mental functioning. It provides valuable insights into their mental state, aiding diagnosis and the development of tailored treatment plans. Recognizing cultural factors is crucial for a comprehensive and person-centered approach.